Hello. What's in?
Catherine, could you maybe mute your microphone, please?
Yes.
Good morning, everyone. If you would all please mute your audio and turn off your video. As usual, that makes the presentations work a lot better. The doctors have requested that we hold questions until the end of the presentations. If you would like to go ahead and type your questions in the chat, you can certainly do that at any time, and then we will read them. Or if you would like to raise your Zoom hand, then we will call on you when there's a break in the presentations. So good. This morning we have Dr. Manisha Pereira and Dr. Edna Biddy. Dr. Pereira is an assistant clinical professor in the Department of Internal Medicine for the UCI School of Medicine. She is dual board certified as a geriatrician and as an internal medicine physician. Dr. Edna Biddy is an assistant professor in the Division of Geriatric Medicine and Gerontology at the Department of Family Medicine in the UCI School of Medicine, UCI Health. Dr. Pereira is going to speak first, and she'll discuss how nutrition promotes health within various diseases such as diabetes, arthritis, heart disease, etc., and also how exercise and diet are fundamental for healthy aging, weight management, and good mental health. When we consider health, it is not just the absence of disease, but rather the integration of daily habits to promote optimal well-being to live a long, healthy, meaningful life. Dr. Biddy will discuss fall prevention, which will include a discussion on the definition of a fall, excuse me, and its impact on individuals and society. There's a special focus on risk factors, as identifying risks is key to prevention. Dr. Pereira, if you would like to go ahead.
Thank you very much, Carol. Just waiting for the slides to be shared.
Here we go.
Thank you very much, Dr. Biddy. Good morning, everyone, and welcome to this very important and very broad topic today. I am very excited to present this in combination with my dear colleague, Dr. Edna Biddy. So really, this topic about diet, nutrition, exercise, fall prevention, really the overall goal of this presentation is to promote healthy aging. And what healthy aging is really being disease-free or controlling your disease states, having a healthy mental state, and also by being social and functional and independent. That really is what I look at for healthy living. So next slide. So this is the Senior Health Center. This is where I and Dr. Biddy, we both work. This is in orange at UCI. Some of you may be familiar with the Senior Health Center, and if you're not, this is what it looks like. Next slide. Today, I'm gonna, in my part of the presentation, I'm gonna focus on diet and nutrition. Really, diet means the food we eat. And nutrition, it's a broader sense of, the supplements and the overall nutritional requirements that we have. And nutrition can also include supplementation, fluid intake. So it's the broadest sense of our diet and the requirements we have. I like to focus on identifying how aging affects our nutrition and talk about what a balanced diet is, and really highlight that a balanced diet can be different to each and every one of us. And then also briefly to go over supplements, its role, its uses, and when it should not be used. Next slide. So as I mentioned before, why is a good nutrition important? It really is to promote your health and your independence. Because we have identified that poor nutrition has been associated with a higher rate of mortality and even morbidity, which is a disease state. And don't forget that malnutrition can be either overnutrition or undernutrition. And we do see both of these in our community today. Next slide. So, as we get older, our nutritional requirements change. Our population is aging, and the numbers are expected to increase as by 2030. At least 20 to about 23% of our population is going to be over the age of 65. So really, we want to promote our senior members of our community to stay healthy and be active and enjoy their best life. So there can be some physiological changes that happen in our body as we age. And our functional state, our chronic diseases or acute disease states can affect our nutrition and its requirements. And don't forget external factors that has a significant role in our diet and nutrition. And in the next couple of slides, I can go over in detail on what I mean by these changes and how these factors affect our diet and nutrition. Next slide, please. Let's talk about physiological changes that happen in our body as we age. Our bone mass can decrease. Our lean mass can decrease. We can lose muscle in our body. And that means fat can replace muscle. So really, we have to change our diet to cater for these requirements, increasing our lean body mass to stay healthy and fit. And later on in this presentation, you will realize it's not only diet, we do have to focus on exercise as well. And our energy requirements can vary. If we are less active compared to our younger selves, we may not be using up more energy. Our energy requirements may decrease. At the same time, at a cellular level too, our metabolic rate can also decrease. But then again, if there's illness, if you're fighting against an infection, your energy requirement can increase. So really, it's a dynamic requirement. It can change. And as we get older, our thirst mechanism can also decrease. So it's not always good to rely on how thirsty you are to take fluids in, because your body may not give you the correct signals. So I really do encourage all my patients to keep track of how much they drink. And my recommendation is, if the weather's hot, if you're going to be outdoors, it's best if you can increase your fluid intake by at least an additional 1 or 2 glasses. As we get older, there can be changes in our taste and smell. And that too can affect our diet and nutrition, because For example, our taste buds decline, so you may not taste food as well. So the enjoyment of food can decrease. And I have seen people who've lost weight because of this. On the other hand, to improve the taste, one might add more salt in their diet. That can lead to high blood pressure and fluid retention. If you have heart failure or kidney problems, that can be a problem. So really, it's important to realize how your body changes and adapt accordingly. You can use different spices to make your food taste better and not necessarily use salt. Next slide, please. Your function can also affect your nutrition. For example, if you have a memory decline, your meal intake can decrease or increase depending on this. One may forget to have 3 meals if you have memory problems, or you may forget you just ate and overeat. So that's an example of cognition can affect your nutrition and diet. If you have problems with transport and problems with moving around, that can affect your diet choices. You may go for, frozen meals instead of fresh food. So really, it can affect how you choose your food. Your dentition is another aspect to how it can affect your nutrition and diet. If you have problems with your teeth, perhaps it's time to switch to more softer food to maintain your nutrition. Your socialization has been identified as a factor that affects our diet and nutrition. And we did see this during the pandemic. Social isolation can lead to poor nutritional intake and weight loss as well. Next slide, please. Disease state. So one may have chronic diseases that can restrict your diet or increase your some nutritional requirements. For example, diabetes, to control your blood sugar because you don't have enough insulin in your body. It's best to reduce carbohydrates that can turn into sugar, and also just plain sugar like candy. It's good to limit. If you have kidney disease, and those who have experience with kidney problems know that you need to limit your some elements like potassium, phosphate in your diet. So those are a few examples of how your health diseases can affect your nutrition. Disease states like chronic constipation, cancer can affect your appetite and lead to weight loss. And don't forget, some of the medications we use can also affect our taste, our appetite, and thereby affect our diet and nutrition as well. So these are a few examples of how various aspects can affect our diet and nutrition. And it's really important to keep this in mind when we have a diet plan and choose our nutrition. Next slide, please. And external factors, let's not forget. Finances. A lot of us spend a significant amount of money on food. So it's really important to take into consideration your finances when you plan your meals. Worldly events like the pandemic, we saw how it affected our nutrition. And education is also an important factor. The more we know, the better choices we can make. Next slides, please. So what is a balanced diet? In the next couple of slides, I like to go over a balanced diet, but I do want you to keep in mind that a good, healthy diet can change from one person to the next. So really, this is a general guide, but what you need to do is talk to your doctor. If you need, you can talk to a dietitian to come up with your own individual plan. Next slide. So general rules when it comes to balancing your diet. Variety of colors, we talk about the rainbow colors. variety of food groups, and I'll go over what those are in the next couple of slides. Paying attention to portion sizes. Some foods you need more of, the others not so much, but really we're aiming to have a little bit of everything. Your personal preference is important because you need to enjoy your food. And there comes the cultural aspect too. There may be foods that you grow up with, that you enjoy. You can still have them, but paying attention to portion sizes, balancing out makes it healthier. And again, the budget, the finances. Next slide. So these are the different food groups that I included that are important for a balanced, healthy diet. Vegetables, fruits, grains, proteins, dairy, soy, and I also want to mention nuts, and also your water fluid intake. So think about these 6 aspects when you think about your diet and when you plan your meals. Next slide, please. So the United States Agricultural Department has a website called myplate.gov that really gives you an opportunity to put in your information and kind of have a meal plan. It's not very specific. It doesn't take into account your disease states, but considers your age, your weight. So you can take a look at this website and get more information. I really think it has very good, useful information. Next slide, please. So let's talk about fruits. When it comes to fruits have a lot of benefits to our health. Has fiber, which can help move your bowels, has lots of essential nutrients like vitamin C, folate, and vitamin like potassium. And also overall, it helps reduce heart disease and strokes. Our daily requirement can change according to our age, our gender. So in general, it's recommended that, you take about 1.5 to 2 cups of fruits a day for women and 2 cups for men. And portion sizes can vary according to what you use. For example, when I say 1.5 cups, a cup could be 1/2 cup of dried fruit, or if it's mashed, it could be 2/3 of a cup. Next slide, please. Sorry, the slide is, half of it is cut off, but I will explain. So when it comes to vegetables, again, a very good source of fiber. If you look at the picture above, it has a variety of colors. So really, it's really inviting all these good nutrients to your body. Fruits, vegetables in general has low calorie compared to grains.
Let me see if I can fix it. Let me see if I can fix it. One moment. Am I sharing?
Not yet. Okay, you're sharing.
If you'd like to go back to the presentation, thank you.
Okay, thank you very much. All right, so going back to the vegetables, so lots of good health benefits, and the portion sizes is slightly more than the fruit requirement. If you look at the slide, for women, it's 2 to 3 cups, and for men, it's 2.5 to 3.5 cups. And again, the portion size, the definition can vary according to what you are eating. For example, if you're eating raw or cooked vegetables, it's 1 cup equals 1 cup requirement, but if it's a leafy vegetable, 2 cups equal 1 cup requirement. Next slide, please. All right, let's talk about grains. So grains is a good source of energy and nutrition, but we need to make sure that, if you have your plate, half of it should be vegetables or fruits and fruits. But, and then the next can be divided into proteins, grains, your dairy, your nuts. So grains, when you talk about grains, there's whole grain and refined grains. Both have its advantages and disadvantages. Whole grains means it contains the entire kernel. And with that comes lots of nutrition, fiber. But when it comes to refined grains, the milling process removes this kernel. So you really lose the nutrition that grains bring to your body. But of course, we have it in the market because it has a longer shelf life. The texture is finer. So for certain purposes, it's useful, but really try to take whole grains whenever you can in your diet. And if it's difficult, at least half of your grain requirements should be whole grain. Next slide, please. And just to mention the benefits of grains, again, the whole grains contains vitamin E, lots of good minerals like magnesium, selenium, which helps with the energy metabolism, muscle health, and also fiber. So really, the requirements can change according to our gender and our age. So I do encourage you to take a look at the website and see how much you need to kind of plan out your meals. Next slide, please. Let's talk about proteins. Proteins are important. It's a good, stable source of energy, but we need to choose our proteins wisely. Proteins include seafood, meat, eggs, poultry, but don't forget though, there are vegetarian sources if you want to avoid meat. So there's beans, peas, lentils, which fall under vegetables, but really they're a very good source of proteins, and soy products too. And when you do use animal products, keep in mind to use lean meat because we want to reduce saturated fats at like less than 10% in our diet. Saturated fat can clog up our arteries and cause heart attacks, strokes, blood, vascular problems. So it's best to minimize your saturated fat. And this includes processed meat like bacon, sausages, which can contain a lot of saturated fat. Next slide, please. So as I mentioned, steady source of energy with proteins and contains lots of good nutrients like vitamin B, vitamin E, iron, zinc, magnesium. And again, the daily requirements are mentioned, but please do look at the website as well. Next slide, please. Dairy. So dairy is a good source of calcium and vitamin D, which is good for your bones. Again, zinc and magnesium. Try to pick low-fat options to reduce your, fat intake. And then don't forget, though, you could get these same nutritional needs by non-dairy options for those who cannot tolerate dairy, who are lactose intolerant. There's lactase added dairy products. Also, there's fortified juices, dairy substitutes like soy milk, almond milk, but they need to be supplemented with calcium, vitamin D to fulfill your daily requirements. And tofu, don't forget tofu. Okay, next slide, please. Okay, so before I move on to supplements, again, I just want to highlight really, this is a general idea about what a balanced diet should be, but those requirements can change according to your needs. If you're in the hospital with an acute illness, your dietitian might give you a different diet plan. So keep that in mind. I do want to talk a little bit about supplements because it is a hot topic, and more so during the pandemic. I think a lot of us got into supplements to help protect our health. So it's important to talk about supplements and identify when to use it and when not to use it. Next slide, please. So some facts, lots of products are out there. And remember though, not everything in the market is good for you, does exactly what it says it does. And then remember that just because it says natural doesn't mean it's good to take any amount into your body. The FDA does monitor these products, but they only start monitoring once they're already in the market. And they don't monitor these supplements as medications. The process is different. They look at it as food products. So they take a look at if it's safe for you, but it doesn't mean that it's going to do exactly what the label says.
This is what shows up when we don't have.
I'm sorry. Okay. Next slide, please. So as I mentioned, natural doesn't always mean good. I really encourage my patients to take in their nutritional needs with diet and natural, like food, because then your body knows how much it needs. It'll take what it needs and get rid of what it doesn't. Sometimes when you take supplements, you take too much. And certain supplements like vitamin B, vitamin C, your body can get rid of, but certain fat-soluble vitamins, your body really cannot get rid of it and it gets stored. So it's important to take just what you need. So if you can balance out your diet, that's the best way to get the nutrients you need. Next slide, please. I do recommend to always discuss with your doctor on any supplements that you are planning to start, because these supplements can have side effects. It can interact with your the drugs that you are already taking. I want to give an example. Supplements like turmeric and garlic, fish oil, it can contribute to increased risk of bleeding. So if you're already on blood thinners, perhaps this is not a good supplement to be on. Like vitamin C can cause irritation of your stomach. And that can lead to a cascade of other things. If you have acid reflux, irritation of your stomach, you may start an acid reducing medicine, not realizing the vitamin C, high dose vitamin C is causing this. But supplements are not all bad. There are some conditions like osteoporosis. If you've had bariatric surgery where your bowels, some portions of your bowels are removed, you will need supplements and you should take it. But it's good to do this under the care of your primary care doctor or your dietitian. And malabsorption states like the bariatric surgeries can require you to take supplements. For an example, some people don't absorb vitamin B12 from their gut. In that case, we need to supplement or give intramuscular injections. So it's not all bad if it's used properly under the guidance of your doctor. Next slide, please. So I want to highlight for a healthy aging, diet, nutrition is very important, but you need to combine it with a healthy level of activity and exercise. So I'm excited for the next portion of this presentation and hear from Dr. Biddy the importance of exercise to your health and fall prevention. Next slide, please. These are my references that I used for this presentation. You can take a look and thank you very much for your attention.
Dr. Pereira, would you like to take a few questions that we have in the chat now?
Yes, yes.
Okay. One of them is, are there certain medications that decrease bone mass?
Yes, that's a good question. Yes, there are some medications that can decrease bone mass. Like if you are on medications to suppress your immune system, like prednisone, that can thin your bones and lead to osteoporosis even before it naturally occurs. As we get older, you can lose bone mass, but prednisone, steroids can expedite it. There's also concerns for medications like we call them proton pump inhibitors, like omeprazole, pantoprazole. It doesn't necessarily reduce bone mass, but it's found out that if you're on these medications for a long time, it can increase your risk of fractures. But again, I'm not categorizing these medications as bad. Don't ever take them, because there are some conditions that you really do need to take them, but it needs to be monitored and tapered off when you don't need them.
Thank you. And then just a comment from someone, pork often has less cholesterol than chicken or fish.
Pork falls into red meat. I have not, I'm not going to agree with that. I've not read anything of, yeah. Dr. Beatty, do you have a comment on that?
Maybe the only thing that I can think of is that it might depend on the way that it's cooked.
Oh, that's
sometimes
true.
when you let's say if you fry your food or use butter, it might change the fat components in your.
Yes, that's right. Yeah, it depends on how you cook, definitely.
I have a question. Mm-hmm. In the past, in years past, I always drank non-fat milk. And then within the last few years, I've read several things that have indicated that maybe it's better to drink 1% milk or even 2%. Do you have any information on that?
So I really think it depends on your nutritional needs. If you have certain conditions that require you to cut back on your fat is not a bad component of diet. You do need it because it keeps you fulfilled for some time. It can help reduce snacking, but it's the percentage, right? So if you can balance it out, it's fine. So I wouldn't necessarily say, I think it's fine to have some healthy fat in your diet, but with portion control.
Thank you. I'm just going to look and see if we have any hands up for, we do. Jody Kristen has a question.
Mm-hmm.
Yes, I'm a little confused about this bone mass. If you've been told that you have maybe osteopenia and you should be taking Fosamax or some version of that, and yet you hear stories that you take it for 5 years and then afterwards you have an increased risk of fracture. I thought it was supposed to increase the bone mass so that it prevents that kind of stuff. And then at the end they say, oh no, it's going to increase your risk of fracture. Can you?
Yeah, that's a really good question, Jody. Alendronate and those medications that help build bone mass has a side effect that causes atypical fractures. It's not the typical fractures you get from having osteopenia or osteoporosis. It's called atypical. It's the mechanism is not very clear, but we do see that people who are on it for years and years have this side effect. So what we do is when you are on this medication for 5 or 7 years, we give a drug holiday to bypass this risk factor. So I know how I understand why you feel confused about this, but really the mechanism, how osteopenia, osteoporosis causes fractures is different to the drug itself causing the fracture. And where it breaks in your body is also different. It's a different location. So that's why we talk about drug holidays when we are on these medications.
What do you mean drug? Okay, it came out holidays. So that didn't translate correctly.
So a drug holiday means you give a break. So usually you give a break of about 2 years for your body to kind of reset. That has been found to reduce this risk of atypical fractures. So if you're on this medication for about 5 or 7 years, we take you off and then you're not taking the drug for 2 years, and then we check your bone mass again and see if you still need the drug, or we choose something else. So that we call in our world a drug holiday.
Okay, so I just thought I'd have a drug holiday and have a great time, but okay.
Okay, I don't see any other questions in the chat, and I don't think there are no other hands raised. So Dr. Biddy, if you would like to go ahead.
Definitely. Hi, hello. I am Dr. Edna Biddy. I do work at the Senior Health Center along with my colleague, Dr. Pereira. And I guess we all know that having a good diet and a nutritious diet specifically, it will lead us to have a healthy structure or musculoskeletal system. That means your muscles, your bones, your joints. And this is important for a great segue for the next topic that is called exercise and falls. So let's start with this. Let's start with mobility. Defining mobility. Mobility is very simple. It's anything that will take you from point A to point B. But what we really are trying to achieve here in that older adults is being able to safely and reliable go where you want to go, when you want to go, and how you want to get there, which basically will translate into maintaining your independence. Now, it is a dynamic process when there will be periods where you will not be as healthy. Let's say, for example, if you are at your baseline, but then you trip, you fall, you cause some bruises and some minor injuries, your body will eventually, ideally, recover from these injuries. And that is what is meant by there will be periods where you will be at your best and periods where you will not be at your best, but your body will eventually recover from this, or that is in the majority of our cases. It's a case-by-case situation. There might be injuries that where we might not be able to recover fully. But really, why do older adults fall? Why are we falling? There are different answers to this that all together contribute to our older adults to fall, and not even our older adults, even for younger patients. As we age, we do have a decrease in collagen fibers, which will lead to a fragile connective tissue. That means that our skin will become more delicate, our bones will become osteoporotic or will weaken, we will decrease muscle mass, and this is an expected transition as we move into an older ages. There is a slow rate, our reflexes will diminish. And an example of this would be, let's say, if we are out in the park and you have your grandchildren, your adult child, and yourself, and you're playing ball. So if we throw a volleyball at the child, they might be able to react quicker compared to an older adult, that your reaction time might be diminished because this is also part of aging. This is particularly important in terms of falling. Let's say if a younger person falls, the chances of recovery or the turnover is very quick compared to an older adult, that our recovery time will be slower, and also it would be harder for us to catch a fall compared to a younger patient. There is something that is called low functional reserve, which is tied into the different diseases that we have as we age. Our balance might not be at its best. There might be medication that we are taking that paradoxically will be causing us to fall, meaning, for example, blood pressure medications are, if we overdo it, if we give too much, that will lower our blood pressure, and that might lead us to fall. In medical conditions that can cause a loss of consciousness, such as seizures, Parkinson's, a stroke, for example. Now, what is the most common place for an older adult to fall? According to the CDC, home is by far the most common place to fall. Now, with the current pandemic, and this data is before the pandemic. I'm not surprised if the percentage of people that are falling at home is higher than 60%. Community is followed by home, and then other will be 10%. By home, by far, is the most common site of an older adults to be falling. There's different types of falls. The most common is a ground level fall or a first floor falls, depending on what region of the country you are. The falls from stairs or steps, it's also one of the common places to fall. Curbside or sidewalks, and fall from a chair and bed and furniture, and other will be the second most common after a ground level fall. It's important to talk about the falls. Why? Because falls are very common, fairly common. One of the reasons why we probably don't pay much attention to falls, especially when we are in early agers, is because we are able to recover, or we might be having a minor injury. Let's say a bruise, a minor skin tear, and we don't pay much attention. But it's important to stress out that there will be falls that might not be as minor falls, and they will lead to a high injury, a high deadly injury. It is said that from the high injury rate of falls, 20 to 30% of the falls will lead us to a serious injury. And what we mean by serious injury is that a hip fracture or brain trauma. And that most of hip fractures in our older adults are caused by a fall. And most of these we've seen it that are more predominantly seen in female patients. And it is also said that from the falls in the brain injury, it's the main common cause of traumatic brain injury in an older adult. So what I would want to stress out about this slide is that falls are common, but about a third of them, 20 to 30% of them will lead to a serious injury. And that is our area of opportunity, and that is where we need to work on. They're not only, falls will not only affect how our body functions or our injury rate, but it also comes at a very high cost. It is said that about the average patient, the cost of a fall will be about $30,000, and these are patients that are actually being seen in the ER. Let's say for a minor, the cost might not be as high for a minor fall or a fall that causes minor injuries, I should say, but it's mostly for higher injury falls. And this means a hip fracture and all the recovery that comes with it. Let's say if you fall, you end up in the ER. If you break your hip, but if you don't need surgery, and eventually you will need the services of physical therapy to be able to recover. And that you might end up at a nursing home, and the cost might add up to not only to ER visit, but all the treatment around the fall altogether. You might have the need to adjust your environment at home, and that will be added to the cost of a fall. And as a society, we have an aging society, which means there's more older adults per year, and that means that there's more fallers out in the community or out in the environment, and that means that the cost of a fall in the collectivity or as a unit, it will increase as the time goes by. Now, let's say, so knowing that falls can be deadly, and knowing that if you are exposed to the community or to the environment, or if you're on the go, it will lead you to a higher exposure to falling. So how some people had asked, so what if I just limit my activities? What if I just stay on the couch or in bed? Or what if I do not go out as much to prevent the risk of falling, let's say out in the community or even within home. And this data is mainly pre-COVID. We don't have the during or after COVID data, which we recommended patients to actually stay home and not be out exposed in the environment. So then there was a study made that it explains this question. So it was seen that this study did compare patients how physical activity relates to falls. And it was seen that if you are sedentary or if you are very active, you will have equal risk of falling compared to falling right in the middle. But what does falling in the middle means, and how much is too much and how little is not enough? So the U.S. Preventive Task Force came with a solution to this puzzle, and it is said that people above the age of 65, the minimum recommended exercise is 150 minutes per week of moderate intensity aerobic activity and at least 2 days a week of muscle strengthening activity. And it's so easy to say, especially us in the clinic. It's the easiest thing to tell patients is to exercise and do weights, but we oftentimes, I don't feel that we take the time to explain to patients what this really means, or what are examples of a moderate intensity in muscle strengthening activity. So the next slide will answer that question. Aerobic exercise will mean brisk walking, jogging, swimming, water aerobics, tennis, golf without the use of a cart, which will include the walking, aerobic exercise classes, dancing, bicycle riding, and cardio equipment. And even still speaking about aerobic exercises, it all depends on what you feel comfortable or how trained your body is to do exercise. Let's say it is not the same to recommend a routine to a person that has been active all their life, or compared to someone that has been mostly sedentary or has had a job that doesn't require much movement. So first we need to start with knowing where our baseline and our comfort level is, and then we can start moving up. 150 minutes of aerobic exercise per week. And this you can break it into different days, or you can, even if you do 75 minutes at one time, it's been seen that it's beneficial. Muscle strengthening refers to mostly weight training, weight bearing, or resistance training. On the same token, it is what you feel comfortable, what your baseline or what you feel comfortable doing, and then eventually the goal is to move up or to build up that muscle, and it will help us with our balance and to become more agile. There are two other types of exercises that we recommend patients. And that are not included in the U.S. Preventive Task Force, but I think that there's key to maintain a healthy body, which is flexibility. Whole body stretching or yoga are examples. In balance training, Tai Chi has been seen that is the most effective type of exercise to promote balance and training. There's other ones out there, Otago, and there's a third one that I can't remember the name right now, but Tai Chi by far is the most well studied, and we have seen quite a great improvement with the balance training. Now, physical activity and exercise is important because altogether, if we become more physically active and we exercise eventually, which is a step up of physical activity, overall, we will maintain our better sugars, better blood pressure. Our mood will be more. We will have a better mood. You will have less chances of becoming depressed. There is also a benefit in terms of your cognition, decreasing the speed of a memory problem. There's lower mobility limitations. There's, for example, if we stretch as we do yoga, it can help us with our bone pain or joint pain pain, and by decreasing the amount of pain that we feel, it would make us feel more comfortable to include more exercise, more aerobic or weight training exercise in our daily routine. It overall decreases our mortality and it leads to a better overall health, which should translate to really what we are trying to aim here, that is a healthy aging and to maintain your independence. Unfortunately, the number of older adults doing physical activities is very low. And now with the pandemic, this rate is even lower. So not that we are promoting vaccinations, we will always encourage to start slow and go slow in terms of physical activity, because there might have been a decrease or a setback because of the safety recommendations. But if you are trying to get back onto the level that you were before the pandemic, it's better to start low, and eventually your muscle memory will activate and you will start becoming more active or more to the level that you were before the pandemic. There are risks. Unfortunately, yes, everything comes with risk. Even drinking water comes with the risk of choking. So the risk is that if you start too fast, you might put yourself at risk of doing too much too early, which your body might not be ready for this, and you can eventually, paradoxically, fall. There are medical conditions that we first need to consult our doctor. Let's say if you are having chest pain, uncontrolled COPD or asthma or severe back pain, then it's better to ask your doctor to how we can improve or maximize these medical conditions in order to have you to be more active in overall be in a better state of health. There in the clinic, there are tools and questionnaires we do ask. They're mostly related to your cardio capacity. Chest pains, shortness of breath, and joint pains are included in this tool. It's called the EC tool that we can use in the office. In the next time, if you are interested in becoming more active, it would be a good idea to ask your doctor about if it's safe for you to start training, or if you're already active, then if it's safe for you to increase the intensity of your exercise. There are medical insurances, Medicare, that do offer services. The Silver Sneakers Fitness, which is a gym that the exercises are tailored to older adults. And you can also, there's also an app online if you are comfortable using technology, that you can log into Silver Sneakers, but before, ask your medical insurance plan if it's covered, if it's a service that is covered, or if you would like to pay it up out of pocket. Silver Sneakers is a great option, and not only offers gyms, but it also offers online classes that you can follow if you feel more comfortable staying at home. Back to falls in the risk factors. There's two big broad categories that where we group risk factors: intrinsic, that is mostly pertaining to ourselves, and extrinsic, that is our anything in our environment that will lead us to fall. For example, intrinsic risk factors, the most important here is a previous risk of falls. If you have fallen in the past, the risk or the chances that you will continue falling in the future are higher than a person that hasn't had a history of falls. Other intrinsic risk factors that we sometimes cannot modify these risk factors, but there's others that we can work on them and improve them. Advanced age, unfortunately is a non-modifiable risk factors. Muscle weakness, gait and balance problems with physical therapy, and a good nutrition, we can improve our muscle strength. Poor vision with a continuous vision exams and procedures and medication, we can improve our vision, because we do need to be able to see well and to have a good depth perception to be able to not to trip and fall. Postural hypertension, this refers to several medical conditions as well as some medications. This means that when you stand up, your blood pressure drops, and this drop in blood pressure doesn't deploy enough oxygen to your brain, and eventually you can feel dizzy, lightheaded, and fall. conditions such as arthritis, stroke, incontinence, diabetes, Parkinson's, and dementia, we can optimize these medical conditions, but there might be some permanent damage that we might not be able to change. But it's also, there is always better to optimize your medical conditions. Fear of falling has also been seen as one of big risk factors. In the isolation is also linked to an intrinsic factor in the risk factor for falling. Now, going to fear of falling, it is said that from overall people that have had a fall, 70% more or less have shown that they have a fear of falling again. And in 40% of these fallers have said that they prefer not to, that 40% have I'm sorry, let me backpedal. I'm a little nervous. From the patients that had a fall, 70% have a fear of falling, and 40% are limiting their activity because this fear is so intense that they prefer to limit that activity. But now we know that even a sedentary lifestyle or a very active will have almost the same risk of falling. Now the 4 extrinsic risk factors, or what our environment or what we can control, is a lack of, or examples are lack of stair handrails, poor stair design, lack of bathroom grab bars, dim lighting or glare, obstacles and tripping hazards, slippery uneven surfaces, medications. Again, it's important to discuss with your doctor and to do a search to see if there are any medication that paradoxically might be causing you to fall. Improper use of assistive devices. We see this very commonly in the office, where canes might not be well adjusted, might be too high or too low, and this will make us lose our center of gravity and eventually fall. Also, if you are using a walker that might not be appropriate for you, it can also lead to a risk of falling, even when the device itself is made to help you with your gait and balance. There are different interventions out there that we have seen that are effective to decrease the rate of falling. It's important to say that every person is different. Every patient's situation will be different. So that's why it's important to have a discussion with your doctor about and explore your intrinsic and extrinsic risk factors to be able to see where our areas of opportunity are and what can we modify to make your environment safety and to optimize your medical conditions. We do here at UCI, we are well trained on fall prevention. And there we also have a falls clinic in which we go over the intrinsic and intrinsic factors. And we do have that conversation with patients and their family members on ways to how to prevent the risk of falling and the risk of falling. And if you are falling, how to decrease the rate or the chances of you having a major injury, such as head injury or a hip fracture. As mentioned prior, balance training is important. Tai Chi by far has been the best balance training exercise out there. Also, if you are attending physical therapy already or you are not, working on your transverse and ambulation is important to ask your therapist, physical therapist, on guidance on how to increase or how to maximize your transverse and ambulations. Vitamin D is controversial. Years ago, it was said that there was a study that said that vitamin D was effective against the decrease of your rate of falling, but it is newer research has shown the opposite. But I would like to take a few seconds up to talk about vitamin D. The main and why we still recommend vitamin D. Vitamin D might not directly decrease your chances of falling, but really what it does is that it provides you with healthier muscles and bones. And by having healthy muscles and bones, we've known that this will strengthen your structure. And with this, it will decrease the rate of falling. It doesn't directly decrease your rate of falling, but it helps you indirectly by strengthening your muscles and exercise. And also, if you're on treatment for osteoporosis, if you start with a low vitamin C, when you start your treatment, if you start with a low vitamin D, the medication, the osteoporosis medication, such as Fosamax or alendronate, we've seen that it's not as effective as when we start with a normal or higher than normal vitamin D level. So that's another way that vitamin D can help contribute with our overall structural health. Other interventions that we can do is that oftentimes there are patients we're go undiagnosed with memory problems. And it is important because if we decide to send this patient to physical therapy to work on their strength and balance, if this patient is not able to retain new information, or if not able to memorize a set of exercises that are being instructed to the patient, that is going to be really difficult to really use physical therapy in their benefit. Education regarding fall prevention is important, and this is mainly tied along with keeping a safe environment, being aware of the steps and bumps that might be in our home and on the paths that will take us to navigate the world, such as going to the pharmacy or grocery shopping if you are still independent or if you're still capable of doing these. It's important to be aware of what our environment is and to be able to be mindful of and be able to see the path in front of us to be able to decrease the rates of falling or tripping and eventually falling. Osteoporosis screening is better to have going along with optimizing your health. Having strong bones would lead us to decreased risk of fractures. Assisted devices that will help us, that we know that are effective, a walker. Walkers can be, there's different type of walkers. You have the 2-wheel walker or the 4-wheel walker. The 4-wheel walker is meant for patients whose gait is speedier than the patient who's is not. And the 2-wheel walker is mostly for slower gaits. And then we have different canes. The one that we have seen that is the most stable is the 4-point quad cane, or the cane that has 4 legs on the bottom. If you feel more comfortable using other assisted devices, it's okay, but it's always better to ask your provider or even your physical therapist if this device is well adjusted to your height and if it's what you actually require to maintain a good balance. Footwear, too loose or too tight footwear, or footwear that doesn't have enough grip, it's important to can eventually make us fall. Using slipper, we oftentimes see patients in the clinic who are wearing slippers even to their visits, and this is can be a hazard, can be a potential risk factor for falling. Vision care is important to be aware of our surroundings in order to find obstacles that might be on our way that might make us fall. Medication review, as we discussed previously, how important it is. Some medication may cause dizziness, some medication may cause a low blood pressure, etc. It's important to have that discussion with your doctor. There's something called a false alarm or life alert. Sometimes there are patients that are falling in the environment. So let me give you an example. If you fall, and it's one of those unfortunate falls where you have an injury that you are not able to get up on your own, and you're just left on the ground, it will be harder to seek for help. That's why false alarm or life alerts have been created, and this is a necklace that the older adult carries, and then in case that they're not able to call for help, they can press the button, and that alarm will connect you to 911 or a loved one that might be able to come to your help. Then now with technology, some people feel more comfortable with technology. I've had patients whose children have purchased an Alexa or Siri or iGoogle, so that when they are in the need of help, they just call, hey, Google, and then the device will automatically connect them to either the paramedics or their loved ones. And the patient can talk to that device and express what their needs are. Blood thinners is the controversial, yes. In the same way, it's important to have a discussion with your doctor about blood thinners. If there is no medical indication for you to be on blood thinners, it is better to stay away from them. Because if you are already falling or at risk of falling, and if you are on blood thinners and it's one of those unfortunate times where you hit your head and you bleed you have a brain bleed, it will be more challenging to stop that bleed if you are on blood thinners. So it is always advisable to stay, to discontinue blood thinners if you are really not needed. Home safety evaluation, there is a service that is also offered for patients that we know that or we have a suspicion that their environment might not be healthy. We can do home safety evaluations through home health, and sometimes through a service called Doctors at Home. There's a provider that goes to your house and assesses your environment and looks for areas of opportunity that we can improve to make your environment more safety. I know that this has been a lengthy talk, and there's a lot of information that has been shared with you, but if there are three things that I would like you to recognize from this talk, is that one, mobility is key to maintaining our overall well-being. The falls are common, costly, but there are also preventable. And it is also important to have a detailed evaluation of risk factors to appropriately target interventions that will lead to a falls prevention. And that's all. Questions?
Thank you, Dr. Biddy. I'm just looking in the chat. We have a question. I'm not sure if this would be for you or Dr. Pereira. My skin has become super, super sensitive. A tiny bump can cause pain and even cut the skin. Is there anything I can do to strengthen my skin?
Oh, that is a very tough question. I think that it is very common to see that as we age, we lose collagen, and this will lead us to have a more frail skin. Some people take collagen supplements. We don't have good data about how beneficial these products are. To my knowledge, there's very little out there that we can do to help with this issue. Moisturizing, if you have a dry skin, moisturizing your skin, it definitely helps. But as far as skin thinning, I'm not sure if there's anything, a product or a medication out there that might help with this.
Yeah, and I like to add staying well hydrated, because if you're dry, your skin gets dry. So that's something you could do to help your skin, but really, there's no magic pill.
Okay, thank you. Another question, is using a cane an effective tool in fall prevention, or does a cane give a false sense of security?
It really depends. It's a case. This is a very good question, and very common in very good question. I think that I would love for our patients and people in the community to ask this question more. Yes, so it just really goes on a case-by-case basis. Let's say, for example, there might be patients who might be better off being on a walker than on a cane. If you already have a balance problem or a risk of falling, is some protection and some assisted device. The use of an assisted device is better than not to use anything at all. It's important here to make sure that this assisted device, either a cane or a walker, that is well adjusted, because as it is meant for a good purpose, but if it's not correctly adjusted, if we don't use it correctly, it might be a trip hazard, and it might not be as beneficial for what it's initially intended for. So it really depends on the case by case. Let's say, for example, if you have a wrist pain or shoulder pain on both sides, it might be safer for you to use a walker instead of a cane, because it will give you more stability in that way. It's a tricky question and difficult question to answer. I think it's more of a case by case, and we need to go more in depth into what your specific situation is.
Thank you. I don't see any additional questions, and there are no hands up. So thank you, both Dr. Pereira and Dr. Biddy, so much. What a lot of really good information. We really appreciate your giving of your time this morning.
You're welcome. It's always a pleasure.
Thank you so much. And just a note about next week, the next lecture will be on November 10th at 7 p.m. And the topic will be the latest technology in improving hearing, including hearing aid technology for the senior population. So we hope we see all of you next week. And again, thank you to both of our doctors this morning.
Thank you very much for the invitation.
Our pleasure. Thank you.
Bye.